When does a baby with bronchiolitis need oxygen? Imagine your little one struggling to breathe during a bout of bronchiolitis. You might wonder when their oxygen levels are low enough to need help. In infants with bronchiolitis, oxygen therapy is usually needed when their blood oxygen saturation drops below 90%. This is measured with a small device called a pulse oximeter that clips onto the baby's finger or toe. If the oxygen level stays below 90% on room air, or if it dips below 88% for 10 to 20 minutes, or even drops below 85% at any time, medical professionals will consider giving oxygen. These thresholds are important because keeping oxygen levels adequate helps prevent hypoxemia, which is when the body doesn't get enough oxygen. Hypoxemia can cause damage to organs and make the illness worse. Bronchiolitis is a common infection that causes inflammation and swelling in the tiny airways of babies. This makes it harder for them to breathe and can lead to low oxygen levels. Oxygen therapy supports their breathing by increasing the amount of oxygen that reaches their lungs and bloodstream. Usually, oxygen is given through a small tube placed in the nose, called a nasal cannula. For more serious cases, high-flow nasal cannula therapy might be used. This method warms and humidifies the oxygen and delivers it at higher flow rates, which can help babies breathe more comfortably and maintain their oxygen levels. The goal of oxygen therapy is to keep the baby's oxygen saturation at or above 90%. Medical guidelines recommend starting oxygen if the baby's oxygen levels fall below this point and they show signs of breathing difficulty. Once the baby's oxygen saturation stays above 90% without distress, oxygen can often be gradually reduced and stopped. It's important to remember that oxygen is only part of supportive care. Other treatments like medications are usually not necessary unless there are specific reasons, such as wheezing or other complications. In summary, if a baby with bronchiolitis shows signs of low oxygen levels or their oxygen saturation drops below 90%, supplemental oxygen is usually needed. This helps ensure their body gets enough oxygen to function properly while their infection heals. Continuous monitoring by healthcare providers guides when to start and stop oxygen therapy, making sure your little one stays safe and comfortable during their recovery. Always consult your child's doctor for personalized advice and care.